Did you know hypertension is a life-threatening condition and is also known as the silent killer? This is due to the fact that there are typically no symptoms, but this condition can wreak havoc in your body without you even knowing. Hi there, we're Huge Health, and today we will be exploring hypertension and pulmonary hypertension. We will dive into some of the latest research on how to prevent it and go over the basics like what it is, how you can get it, and more. Before we start, please consider subscribing to our channel and giving this video a like if you find it helpful. Also, we do have some great products linked in the description box below that will really help you on your health journey. If you or someone you know is suffering from excessive weight or struggling with weight management, make sure to check out our weight loss product we've researched. To start things off, we have to know what hypertension is. Hypertension is also known as high blood pressure. And blood pressure can be defined as the force exerted by the blood against the walls of the blood vessels. Now, in order to be classified as having hypertension, your blood pressure reading would be 130/80 or higher. You might ask, what does 130 and 80 represent? Well, 130 represents your systolic blood pressure, whereas the 80 represents diastolic blood pressure. Systolic blood pressure is the reading when pressure is put on the blood vessels or arteries when your heart contracts and is pumping blood. Diastolic blood pressure is the reading of the pressure of your blood vessels when your heart is relaxed and filling with blood. For example, a healthy person's blood pressure should be 120/80 or lower. There are two basic categories of pulmonary hypertension. The first is called idiopathic pulmonary arterial hypertension, or IPAH, which currently has no known cause. If this condition is left untreated, the average life expectancy is approximately 2 to 3 years or as little as 6 months depending on the severity. The second is secondary hypertension. This one is caused by medical conditions such as kidney disease, hormonal disorders, or even sleep apnea. There are several ways to lower your blood pressure, including treating any underlying conditions, medications, and lifestyle changes. The first step in managing your high blood pressure is to target what is causing the spikes. For example, if you have an underlying condition causing your problems, the first step is to cure that condition, which might include a kidney transplant or sleep apnea machine. Some lifestyle changes may include weight loss, more exercise, quitting smoking, or figuring out a way to reduce stress. If you are looking to change your eating habits, make sure to watch our video on the #1 diet for 2023. What are the best cures for pulmonary hypertension? If you or someone you know is struggling with high blood pressure, the first thing to do is look at your diet and exercise. Diet and exercise is key to keeping your whole body healthy. Unfortunately, pulmonary hypertension has no cure at this time, although there are some ways to help. If you are diagnosed with this condition, your doctor will most likely prescribe you a medication that will reduce the workload on your heart. The main goal of this medication is to dilate the blood vessels in your lungs so that your body doesn't have to work as hard. Working closely with a healthcare provider will be your best bet on managing this condition. Some of the medications that are available are calcium channel blockers, endothelin receptor antagonists, prostacyclin analogs, and phosphodiesterase 5 inhibitors. These medications each have their place and can help individuals in different ways. Another viable option is a treatment called oxygen therapy. Oxygen therapy is what it sounds like. This is where a person is administered oxygen either through their nose or mouth in order to get some relief from all of their conditions. These conditions include shortness of breath, fatigue, and chest pain. What does living with pulmonary hypertension look like? Many activities that deal with lung capacity and breathing are much more difficult for individuals with this condition. The symptoms include shortness of breath, fatigue, chest pain, difficulty sleeping, and limits on physical activities. While you can live a full and happy life, living with pulmonary hypertension can be quite the challenge. Depending on how severe your situation is, simple activities like walking or climbing the stairs can be a big task. Not only does living with this have an impact on your physical activities, this can take a toll on your mental and emotional health. Anxiety, depression, and isolation can be a factor when you have pulmonary hypertension. This is why it is important to work closely with your doctor when taking any of these medications. How many doctor visits does someone with hypertension have to go to? According to myphteen.com, a young woman named Rosetta had to visit the doctor every 2 to 3 months to monitor her condition. In her case, at the time, she was considered a high-risk patient. In 2014 she was put on 2 different medications, but in 2021 she was given a third. Luckily for her, these medications have put her out of the high-risk category. She now only has to visit every 6 months. When you go to the doctor with pulmonary hypertension, some tests may include a blood test and a walking test. This helps determine where you are at and how well you are doing with this condition. There you have it. Like we previously stated, living with pulmonary hypertension can be a challenge. We hope you found this video informative and hope it helped you answer a few questions. Before we go, please subscribe to our channel and give this video a thumbs up. Please let us know what you liked in the comment section and tell us what you'd like to know more about. Don't forget to check that description box below for some great products. Thank you all and we will see you in the next video.